Hi there, I'm Dr. Healy at Pain Stop North Scottsdale, and I want to thank you for tuning into the Pain Stop channel. Today I'm going to talk to you about some of the steps you could take after a fall to reduce the acute pain that you may experience. I want you to remember one word, RICE. Rest, ice, compression, and elevation. After a fall, you want to rest the injured area. Take it easy. If it's your ankle or your knee, try to stay off of it, relax it. Don't go out and play a game of basketball. Ice. Ice helps reduce inflammation. Cooling the area will force blood out, reducing the swelling and inflammation of that area, be it the knee, ankle, shoulder, or elbow. You can also use a topical agent, something like Biofreeze or Dr. Hoy's. These are natural cooling agents which will help increase the effects of that ice. The next one is compression. Compressing the area will again help reduce inflammation. If you've ever done a knee wrap or some other sort of compression, even holding the area, pressing in on it, it'll help stop bleeding and again reduce inflammation. Elevation. If you do have a cut and it's bleeding, the best thing to do is to elevate the area to reduce blood flow to that area. So if it's an ankle or a knee or an arm, you could raise that up and it'll reduce the blood flow. So remember, rest, ice, compression, and elevation. My advice to you is to keep this information handy, keep our blog bookmarked so that you can come back to it if you ever do have a fall. And then schedule an appointment at your nearest Pain Stop clinic, either that same day or for the very next, and we will take good care of you. We hope you found this information helpful. Share it with your friends and family, and as always, your pain stops here.